Sarah. Yes, my name is Audrey Gadeko. I'm a professor at the Department of Communication Studies at the University of Ghana. And as Sarah said, I'm part of Pandora. My background obviously is in communication studies. So you are likely to detect the biases in what I present today. I just want to start by stating the obvious, the fact that COVID-19 has brought to the fore issues of ethical responsibility of different sectors of our social, cultural, and economic life. Of course, the question of research ethics has always existed and predates the COVID pandemic, and I'll cite some examples to make that point later on. But I do think that the constantly compounding nature of the pandemic poses particular challenges when it comes to community engagement and science communication. And so it sort of magnifies the ethical conundrums that must be navigated. So I was just making the point that COVID poses particular challenges when it comes to community engagement and science communication, and magnifies the ethical conundrums that must be navigated in conducting research. And at the same time, the pandemic is eliciting a lot of research demand at a faster pace than usual because of the need to better understand the epidemiology and biology of the virus, and importantly, to help inform local decision making, and also to help, and this is important, counter misinformation. So, research is needed, and it calls on researchers to improve on how they engage and inform stakeholders, including local policy actors and the general public. So, what are the ethical issues with, let's say, community engagement? We know that community engagement is important, not only in eliciting information for research or informing and educating, but also in helping to understand the priority health needs of the community engaging, how best to address their needs, and of course, how to design the research to get the best outcomes. Now, the primary ethical problem during a pandemic like COVID-19 starts with how to conduct research and community engagement safely. And because there are constraints due to control measures such as lockdowns, restrictions on gatherings, physical distancing, etc. In our part of the world, the interface between researchers and communities has always relied on face-to-face methods, focus groups, communal meetings, debates, etc. So how do we do rigorous, inclusive community engagement under these circumstances? In research we have been conducting at the University of Ghana, we've tried as much as possible to still conduct face-to-face community engagements because we think that's better. So researchers have to follow rigorous safety protocols. So conducting engagements in open spaces, for example, is a must. Spacing out, maintaining social distancing, providing nose masks and alcohol-based sanitizers at all times during data collection to everybody, not just the researchers, but the research participants to be worn, and sometimes leave the community with some of these things. And that's non-negotiable. So for safety reasons, also though, we can be tempted to use technology rather than face-to-face. And of course, COVID-19 has made us more reliant on technological tools. So we can organize virtual events, and indeed. So I was just saying we found we've used virtual engagements for perhaps narrowly just for key informant interviews primarily, because we recognize that there's a substantial digital divide. And therefore, if we over-rely on virtual engagements, it would limit who we can include. There are connectivity issues. We're just experiencing one as I speak. Access to the means of technology such as Zoom in rural areas, and even electricity. So face-to-face engagements are still important for researchers, do. And I think it also has the advantage of giving a visible presence within the community that can contribute to transparency and building of trust within the community. You know, botched Ebola vaccine trials in Ghana provide lessons on the value of thorough community engagement and the value of transparency, trust, and other ethical issues. Many of you will recall that sometime in 2015, Ebola vaccine trials were abandoned in Ghana amidst protests from members of parliament and the general public about a secret, in quotes, vaccine trial that risked introducing Ebola into Ghana. Now, research, some of the research that has been conducted, for example, research by Kumavold et al., found that perceptions that the trials were secret arose from a combination of premature news reporting, so the role of the media, and then the fact that the trials were prohibited from conducting any publicity before being approved at the time that the story then came out. So timely communication is important. Timely community engagement is important. And because this did not happen, it created an impression of secrecy. The accusation of secrecy, therefore, should raise in our minds the issue of transparency and candidness when researchers are conducting research generally, but in particular, research on epidemics and pandemics, where there's likely to be high media attention and public interest. Vaccine media rely on scoops. So if you do not brief them and they find out, it's a scoop for them. Vaccine boycotts, we know, are not new. Northern Nigeria in 2003 boycotts were fueled in part by memory of the controversial trial of the antibiotic Trovan in 1996, in which some children died. So the lesson here is that fear and distrust associated with vaccines draw from the contemporary context of outbreaks, but they also draw from long-standing historical issues of vaccine skepticism, of skepticism about science and Western medicine. So it's important when we're conducting research, community engagement, to understand the context and experiences of stakeholders and the source of distrust or rumors when we're engaging them so that we can address them. Media reports also now suggest some African governments are planning to produce vaccines. So in one of the COVID-19 updates in my country in July, my president announced that Ghana had committed seed funding of $25 million for the local production of COVID-19 vaccines. So we're waiting for that to start. However, I think that researchers ought to be mindful, therefore, of the importance of transparency, of carefully planning public dialogue about vaccine research plans, etc. It's also important that research should be conducted by trusted locals and negotiated between communities, researchers, and ethics committees in research study sites. Some of the research on the media discourse on the Ebola vaccine trial in Ghana, for example, found that local researchers were accused, wrongly, of course, because I know them well and I know they are trustworthy, but they were wrongly accused of breaking, and I'm quoting, breaking the moral and ethical responsibility of protecting the lives of Ghanaians, and they were framed as conniving with evil foreigners to infect Ghanaians with the Ebola virus and hiding the true nature and purpose of the trials. Like I said, and there was just so much distrust that the trials had to be discontinued. Another bone of contention from the Ebola vaccine debacle we can learn from was the accusation that there had been a lack of consultation of key stakeholders, even though, for example, one of the chiefs of the study site said he and his opinion leaders had been consulted. Ironically, one of the key critics was the Ghana Academy of Arts and Sciences, which should have been a natural ally. So you have to wonder what happened, because the Academy issued a press statement stating that, and I quote, "It was unsafe to undertake the trials in Ghana." And that statement included a list of 10 technical questions that they said had to be addressed. And because they were an authoritative, trustworthy expert source, they are wading into this public debate and asking questions, legitimize some of the unfounded claims and concerns that were found in media reports. So the lesson here is should we be considering as stakeholders? How wide a breadth of stakeholders should researchers be engaging? And again, I think when it comes to issues that have particular salience like epidemics, you ought to think of your stakeholders, not only the communities in which you're operating, but the media and the larger Ghanaian society, particularly the scientific community. Also, issues of incentives can become a thorny issue that I suspect most researchers continue to grapple with. Some of us have tried to provide transport money, or if we have virtual events, we provide money for airtime to participants. But again, Ebola vaccine case studies suggest it can be a landmine. So the ethical dilemma here is how to communicate on incentives and the quantum of what should be offered as incentives. The media in that case, in the Ebola case, revealed that participants in the trial were given 200 Ghana cedis, which is quite substantial in Ghana. Not much money, but still substantial in the context of poor communities and mobile phones. So some of the framing of the incentives suggested that they were being bribed to take part in a risky venture. Other people felt, oh, they were risking their life. That money is too small. And so that's something we need to grapple with. What's a good balance?
1 minute. Sorry. Oh yeah, your last one. Thank you.
Oh, I haven't even come to communicating science yet. But my last point on community engagement dovetails into the challenge of science communication. And that is the risk of misinformation and how to communicate controversies. And the fact that, there's uncertainty. So how do you communicate uncertainty? And there are quite a few examples I wanted to share in Ghana. The politicization, the fact that researchers haven't been trained to communicate much in the media, and yet COVID-19 requires that they communicate much more than they used to. There's a lot of media demand for expert scientists to communicate, and sometimes, without knowing what news values are, without knowing how the media logic is, they unknowingly wade into controversy. So maybe I'll stop here, and during question time, I'll come back to some of these issues. I have a lot more to say on the subject.
Thank you for the opportunity to contribute to this discussion. It's been really enriching and inspiring listening to many of the other speakers. And thank you for those really great conversations. So I'm just going to add to what has already been said by perhaps focusing on an aspect that I think is really important when we talk about health, about COVID, about community engagement, about ethics, and also about science communication. And what I want to talk about is something that I take from lots of researchers who have critiqued a lot of this hegemonic framework, which tends to define how we engage with the continent, or knowledge on the continent, or knowledge about the continent. And I want to borrow from a long history. One is the work of people such as Mudimbe, who have spoken about the colonial library, which tends to define, or the colonial archive, which tends to define how we see ourselves and how we think today. And there, what they try to emphasize is that in whatever we do, we need to really take seriously the history of ideas and the history of concepts. The other is a critique, especially from African feminists over the past years, who have pushed, like people like Ifeoma Madiome, Obiama, Oyeronke, Amina Mama, and many others who continue to emphasize that even when we become part of global conversations, what we need to do is to also look at the ways in which a particular phenomenon manifests in our specific context, because as they argue, we do not all experience these phenomena in the same way. And over the past years, scholars like the Mozambican scholar Elisio Macamo at the University of Basel has emphasized the need of what he calls a scientific, paying attention to scientific conceptual vocabularies. And what he's arguing for is that in order to emancipate ourselves as a continent, and in order to actually have kinds of development or health interventions that respond to immediate and contextual needs, what we need to do is to find scientific vocabularies that help to explain our everyday experiences, so that we do not understand the world through other concepts. So what he's trying to do is to find ways by which we make our lives, our experiences more intelligible, both to us and also to various communities. So when we talk, for example, about communities, every time we talk about communities, the assumption is that we are talking about people who are not part of the mainstream. We are talking about people whom we generally see as not very literate in what we call modern, or people who sometimes just fit for us to laugh at. So asking that we interrogate the scientific vocabularies, or vocabularies that we use either for science communication or to intervene, means that we need to begin to ask questions: what we mean by community, and how we should be defining the people that we call community, and how we should be defining our relationships with these people. And one of this is also this idea of ethics. You know, when we talk about ethics, what do we mean conceptually? We've seen in the previous discussions that ethics itself is something that is framed around the ideas of a Cartesian subject, a subject who is coherent, a subject who is not malleable, a subject who does not change. So when one regulates that subject, one is regulating the moral behaviors and relationship of that subject. But what does it mean to talk about ethics in a society that is made of obligations, a society that is made of relationships, a society where one owes, you know, their everyday lives to connections to people? And already I think we've seen from the responses from the Africa CDC that the Africa CDC is also founded along this idea of what I think Benin scholar Pauline Otonji calls extraversion, that we have to find ways to introvert. Already, I think the Africa CDC is doing really fascinating work across the continent with building a space that allows us to have these kinds of conversations, but also to intervene in particular ways that respond to our everyday needs. What we need to do, but whether as health scholars, as scientists, or as people in the social scientists, is now to invest in finding ways in which we find particular concepts that help us to explain risk, for example, to explain danger, for example. For example, the interventions that we have today for COVID-19 are framed along particular notions of what risk constitutes. Risks in a particular society that does not have experience with fear, that does not have experience with danger. So how does one then frame risk and interventions to risk in a particular society? So that's I think one the key intervention that I would want to bring, that an epistemic shift requires that we really invest in finding vocabularies, in interrogating these concepts that are really important, that we are not denying that this knowledge is important, but how do we find words and concepts that help us to relate to it better and also to explain it to people without necessarily assuming that these people do not understand what we are trying to explain. So any effective science communication on the continent in a health context must ensure that it is translated, must ensure that it finds concepts, must ensure that it invest in the histories of concepts and ideas, and also in the histories of interventions in order to better communicate it. Sarah, I think I'll end there for now. Thank you.
Thank you very much indeed. Yes, that was enormously, well, tantalizing. I mean, the thought of a community comprising people who don't know fear, and so the difficulties in conceptualizing risk hasn't even occurred to me. So and I'm sure that there's an awful lot more I could ask you, as could everyone else, but I'll let you off the hook for now and move to Francis, our last speaker of the day, before we wrap up and summarize. Thank you. Right, over to you.
Thank you. All right, so I hope you can all hear me. Can you hear me?
Yes, yes, yep.
All right. So I think you have my profile, so I'll just go straight to my presentation. And I'm going to start off by briefly, contextualizing this presentation. So we come from a continent that is perceived as the cradle of mankind, which basically means this is where life began. And we also contribute to nearly 20% of the world population. Apparently, we are one of the continents that is highly, lucky to be endowed with a lot of natural resources. We are rich in cultural diversity, religious diversity. But on the flip side of it, we are also one of the continents with the highest burden of disease. And over, the last 2 decades or so, we have seen quite a dramatic increase in the number and complexity of research studies that are happening within the continent. Now, this raises a lot of opportunities, but also, controversies in terms of, how exactly, researchers ought to conduct, research in the continent in a way that is more inclusive in terms of involving the community, but also in terms of making sure the research responds to the needs and the expectations of the communities that are involved in research. If you just look at how ethics then has evolved over that period of time, you see that, and the previous speakers have talked about this, and I just want to contextualize this within the context of community engagement. We see a situation where, people, originally coming to the continent to conduct research once approval has been obtained from, the global north. But over and over, gradually, we see some of the international guidelines introducing the need for local review. And, gradually that becomes like now a requirement. We have heard from, previous speaker that, when they tried to understand why local review was necessary, the answer they got was because they cannot get funding, without, a review. And this has been the case over quite a period now after, it came into the international guidelines. gradually you could not get, funding without, having local review or local approval. I want us to reflect at this, within the context of community engagement, because community engagement has gradually also become part and parcel of, research. You see a lot of now, research institutions incorporating, community engagement as part of clinical trials, community engagement as part of, social science studies. Now, questions begin to arise as you reflect on this, and especially putting into context how research ethics evolved from the beginning. How, in terms of community engagement, and especially when you look at it from the perspective of drawing and developing partnership with communities, how engaging is community engagement? To what extent are really community allowed to or empowered to make decisions when it comes to community engagement activities? The literature now, when you start reading the literature, you begin to get a sense that community engagement is easily being used as the carrot, where you begin to establish community engagement activities within programs in order either to attract funding, but also to be seen as engaging with the community. But in actual sense, the question still remains, to what extent are communities really involved in decision making, and especially in deciding what activities or what research activities and what research benefits should accrue back to the communities. So I'm not going to offer answers to these questions, but they're important for us to begin to reflect when we talk about community engagement. Now, a bit of some resilience on the history of Africa and how Africa has coped or has tried to cope with some of the emerging and re-emerging infections and pandemics that have ever occurred. I don't want to go into the details of what happened during the Ebola outbreak and the Lassa fever in Nigeria, but what I want to highlight in this slide is that in both these outbreaks, there were significant misinformation, misperceptions, and mistrust that emerged from the community. And especially if you try to reflect on what happened during the Ebola outbreak in West Africa, there were lots of behaviors, health behaviors and misconceptions that were attributed to the growing infections that happened in the region. Now, when we try to look at this within the context of COVID-19, one fails to understand how were those lessons that happened during that time, how were they put into consideration in the interventions and the education and community engagement that went into the COVID-19 response. You ask yourself, for example, what are some of the the responses, the local responses that you could try to reflect and say these were developed or these were devised based on the on local engagement or local responses and interventions. We see nearly a copy and paste transition from interventions that were all over in the media, and some of them published in local newspapers, some of them in journals, but then almost cut and paste into local interventions. At what extent were community views were included in health education and promotion? We see very little happening with that, and to what extent were communities really involved in inputting on or providing views in what went into some of the responses and interventions that went into COVID-19. So some of these are these are some of the questions that you when you try to reflect in terms of what happened during the Ebola virus, disease outbreak, and what happened during this pandemic, you see there's quite such a disconnect, and you wonder, why did that happen? So if we try to look at this in terms of the implication, one would have, and the previous speakers have already alluded to this, it is important to even to try to understand who our stakeholders, when it comes to health promotion and community engagement, who are we talking about? When we talk about community engagement, now we have broadly expanded this term to public engagement. We need to, at any one given time, whatever interventions we are talking about, we need to be able to understand who are our stakeholders and what are issues, what are some of the issues that we try to address when we talk about community engagement. We know that when it comes to research, we have a lot of research literacy in the community, especially those communities that are even involved in research. How do we deal with this? Research, therapeutic misconception, especially for pandemics like COVID, where there's a lot of fear, there's a lot of vulnerability from those people who are infected, but also from people who are associated with those the people who are infected. How do we deal with this, all these issues? So these are important considerations when we start talking about or trying to think about community engagement within the context of pandemics like this, but also just to try to learn from the lessons that are, to take up the lessons that we could have learned from previous outbreaks. So what are some of the things that we need to understand when we need to consider when we begin to think about engaging the community? And these are some of the values that probably are important for us to think about. Are we together? I'm hearing some. Am I still connected, Sarah?
Yes, you are, but
You are.
going slightly in and out. But yes, good enough to carry on.
All right. So
you.
some of the values that we know now exist and these are available in the literature are things about just how Africa as a region we relate. And previous speakers have, and the philosophers who I do not want to negate here, have alluded to these values in terms of, do we look at Africa in terms of one single block where we subscribe to the same values, or do we look at Africa in terms of different pockets of communities that subscribe to different values? Respect, which is a very generic value in terms of just trying to understand who do we deal with and what values do we propagate when we talk about community engagement? How do we enter in the community? What are our entry point and whose values or whose opinion matters within the community? We also see a lot of mistrust, for example, when it comes to communicating about research and communicating about some of the therapeutic misconceptions that exist in the community. How do we deal with this? When we talk about honesty, how do we ensure that we are honest enough to develop trust and to build trust, with the people that we engage? So we must also try to understand this from the perspective of the historical injustices that happen, because it is based on this that we see there are lots of mistrust that happen. It is not unusual, for example, to go into a community where they begin to talk about COVID vaccine as as an intervention towards, for example, making men infertile within the community, or making women infertile within the community. How do we deal with these things? So there's a need for us to think seriously about some of these, where these mistrust come from, and be able to deal with the core issues around this mistrust. Building trust, trying to address some of the misconceptions that exist, but also putting, investing resources to try to strengthen the community systems that exist, because there are already systems in place that are happening and that are able to address some of the concerns and that are being respected largely by the community. How do we strengthen these systems in a way that we can take advantage of them and reach out to the community that we target? I think one weakness with community engagement is the ability to evaluate and document evidence and share learning. And I really want to, call upon, stakeholders of, community engagement, practitioners and stakeholders to really be able to document and share evidence, because there are lots of, success stories when it comes to community engagement, but these success stories are not readily available for people to learn from and take up the lessons. And of course, the issue about power and resource imbalance, which brings in a lot of issues around whose voice matters within the community, but also just the stakeholder engagement in terms of just the local and international community, and how we balance this these power imbalances and resource imbalances in a way that nurtures trust and transparency, in a way that promotes more collaboration and also more partnership with the community, because it is based on this and the things that are published in some of the in some of the social medias that go a long way into damaging the trust that the community has about interventions, for example, that are believed to emanate from the global north and coming to the global south. I cannot have overemphasized this slide, because even as much as we can talk about researchers as the cornerstone, or research as the cornerstone to health problems, we do know that in a context where there's a pandemic like COVID, researchers do not invest a lot of attention into communicating about their studies. So what will happen is they will be doing great work, but the communities can sometimes have a totally different understanding about what is happening. So it is really important for us to think about science communication as a way of just responding to some of the misconceptions and some of the mistrusts that are, exist within the community. We know now, within the context of social media, there's a lot of fake news, conspiracy theories, stigma, just the negative wave, waves across continent misinformation. All these are issues that must be addressed when we want to think seriously about take up of or intake of interventions, and especially just health promotion. It's really important. So just as I conclude, I want to really emphasize the fact that the pandemic presented very unique challenges, especially within the low and middle income countries, and we really need to as much as possible, and from the past pandemics, but we also need to be able to share some of the lessons we got. And I can't, like I said, I can't overemphasize the importance of community engagement and science communication in the fight against any emerging outbreaks, especially within the context of just communication and community engaging communities and stakeholders for that matter. So I want to conclude by saying it is important to engage stakeholders and involve them fully in terms of just shaping the discourse around what is appropriate and what is not appropriate in terms of just the uptake of certain interventions, and just generating general understanding about what the science community is doing. It is important for the African CDC and AU to be more proactive in resource mobilization and also engagement, because we see different pockets doing different kind of engagement, and sometimes this is what brings a lot of confusion. So it will go a long way in just strengthening this area if information was coming from one source where this source is more trusted, and we know we can only hear about certain issues when we can trust certain information when it comes from this source. I think there's really a great need to invest in local investment in R&D. We have seen quite a good lessons emanating from Rwanda, for example, in Senegal. All these must be communicated in a package that can bring trust and can bring more transparency generally to the community, so that people can be able to trust more, to trust research more, because there's very little trust in research, and that is an area that needs to be addressed. Over and above that, I think looking at the community as co-creators and co-owners of research intervention is really key. Like I said in my very first slides, we talk about community engagement, but do we really go out of our way to empower communities in a way that they can have a voice in whatever we do? To what extent do communities get involved in co-creating the research agenda and co-owning the research agenda that we develop? So these are areas that we must think about, because the community is out there believing that if the community believes that research is done for their benefit, is going to trust, is going to believe in research, and that is going to go a long way in terms of just bringing transparency, bringing trust, and ensuring more intake or uptake of research research results. I want to finish up by acknowledging the Global Emerging Pathogen Treatment Consortium, which is a consortium that was developed especially during the Ebola outbreak in West Africa, and was very instrumental in bringing African stakeholders to especially think about stakeholder engagement and community engagement during the Ebola outbreak, and especially the ECPAS working group, which is the Ethics, Community Engagement and Patient Advocacy Working Group, was very instrumental in ensuring there's buy-in and there's input from especially survivors, but also just the general community in terms of research that was going on during the outbreak, and just trying to understand, address some of the fears and misconceptions that were very, were very prominent during the outbreak.
Specific questions that have come up in the Q&A that we could probably deal with in one or 2 minutes. Do you think that returning research results should be required of researchers? And if so, couched in what terms and why? Either Divine or Francis, if you're happy to take that in very short order, that would be wonderful.
Okay. I can start. Yeah, thank you, Sarah. And also thank you for the question. And you're right. I mean, we can be here for the next 10 years debating what others have debated for the past 100 years. So, but it's good that we're having this debate because also theory and conceptual work is the basis of any intervention. Conceptual and theoretical, and also methodological work. I think methodological work, I think we risk repeating the same mistakes that others have done. I mean, we are 60 years post-independence and we're asking the same question. So that should push us and tell us that we need to go back to basics. Yeah, but when you ask, well, should we return results to, communities? Yeah, I'll say yes and I'll say no. Yes, because it's important to have transparency, and also that when one has engaged people, accountability is really important, but also every knowledge is co-production, and it's important that you share what has been co-produced with people. It's just proper, you don't come to people to borrow something to use, and then after you go back and you don't show them what you used it for. So that's one. The other is just that, you know, most research is driven by selfish needs. People are sitting somewhere quiet, having a good time, a calm time, and somebody sits somewhere, invents something, and invents the idea and the illusion that the people have agreed to what they want to do and they like what they want to do. And they convince themselves that this is a co-production. I mean, people are just sitting having a great time. And you've decided, you know, today I want to go ask this question. I want to have a degree. I want to have this. I want to have that. I want to publish, etc., etc., etc. So the answer is yes, and the answer is no. Yeah. But transparency, honesty, and commitment to people and community is what we need to privilege. Yeah.
Yes. Yes, thank you. That I think that's a full enough answer as we've got time for. I think what we could do in order to summarize today in 1 or 2 minutes, I think is simply to say and to recognize that a lot of what we've talked about today has been in order to preface tomorrow the talks we're going to hear about how to make the systems of governance of research trustworthy, as well as whether or not communities actually invest or trust in the processes of research. But we're also going to be looking at the limits of consent and what place community engagement has in the whole governance of research. So trying to link up in very practical and specific ways some of these discussions that we're having from sort of different approaches. And of course, then there are questions of methods, whether we need a different ethics for different sorts of study designs, whether qualitative research is substantively different from quantitative research. So we'll be going through all of those questions and drill down in much more detail for more specific and concrete conclusions, but which we would be able to continue via the online forum, which I very much hope people will be signed up to.